There are two types that insomnia can manifest, and insomnia is a difficulty in falling asleep or waking up from sleep and then having a difficulty in falling back asleep. Insomnia can happen when we first go to sleep and we go to bed maybe 10, 11 o'clock and we're lying there and we just find it difficult to fall asleep quite quickly. With normal sleep, when you go to bed, you should fall into sleep within a couple of minutes. And that can be assisted by breathing in and out through the nose, but also by breathing light before sleep. So if you want to fall asleep quicker, spend the last 10 minutes before you're about to go to bed breathing light and breathing slow. In other words, taking that really soft, gentle breath in through your nose and a really relaxed and slow, gentle breath out, and do it to the point of air hunger. That will help you to down-regulate. So if there's any overstimulation of the mind, it will help to bring you into the rest and digest response, which is conducive to falling asleep more quickly. Breathing through the nose is, of course, very important, because if you have your mouth open, you're more likely to have a lighter sleep. So to fall asleep readily, spend 10 to 15 minutes before you go to sleep, breathing light, breathing slow, but also maintain nasal breathing during sleep. Wearing myotape may be necessary if you have a habit of breathing through an open mouth during sleep. The second form of insomnia is you're after having about 4 or 5 hours of sleep and then you wake up. You're lying there, it's 2 or 3 o'clock in the morning. You're not quite awake to get up, but you're not quite tired enough to go back to sleep. So what might cause you to wake up at 2 or 3 o'clock in the morning? Faster breathing pattern. So if you're breathing quite hard and fast during sleep, the brain can arouse you from slow wave sleep and you wake up. And that can be influenced by, for example, if you have asthma, you may have a tendency to be breathing faster and harder, especially if you have a lower control pause, or if you have anxiety or panic disorder, for example, or if you have faster and harder breathing, in other words, dysfunctional breathing patterns. Another aspect that contributes to the speed and depth of your breathing is the temperature of your room. The bedroom should be cool, and also, while we're asleep, we don't want to be excessively warm, because if we're excessively warm during our sleep, our breathing speeds up. And as our breathing speeds up, we're aroused from that deeper sleep towards lighter sleep. Other factors that will cause us to wake up at 2 or 3 o'clock in the morning could be overstimulation of the mind. We're going to sleep, we have stress, we have anxiety, and that in turn can cause us to wake up. A dog that's barking in the background, of course it could wake us up. Or if there's light coming into the room, it can wake us up. So adopting sleep hygiene is also very important. At the top of the list, I would put nose breathing during sleep. Absolutely. The second factor is to reduce your breathing, breathe light for 10 to 15 minutes before you go to sleep. And then consider that your bedroom should be dark, it should be airy, it should be silent, and it should be cool. And those are essential elements in helping to improve your sleep and to reduce the risk of insomnia.